Welcome to my YouTube channel. I'm Dr. Hassan. So today we are going to discuss few common mistakes in Simman station in plab 2 or Ukmla 2 or even in your EALS or ALS exams. Most of the doctors who are gonna give us plab 2 exams soon, this video is really useful for those. So let's start. In this video I have focused few common mistakes that usually doctors do in their exams, so especially in civil station. So we will discuss these mistakes, and it will be helpful for you in your exams. By avoiding these mistakes, you can get maximum marks in your plab 2 exams. Okay, so if you haven't watched our previous two videos on general approach of Simman, you should watch those videos, and it will definitely beneficial for you guys. So you will understand in better way, and we will start these points. So first of all, introduction. So in introduction, in our previous videos on Simmen, I have discussed that how to introduce yourself and what should be in introduction part. So if you haven't watched the introduction part of general approach in Simmen, you should watch the video, and you will understand in better way. Okay, so in this introduction part, first of all, body language. Whenever you enter in the queue or exam room, the examiner will assess your body language. Your body language should be very energetic, and you should be like a very vigilant doctor. And rather than your body language might be some laziness or something like you scary, and this will not work. So you are working in accident and emergency. Actually they are assessing you about accident and emergency cases, so your body language should be very active and energetic. Okay, so the second thing is the universal precaution. I have already discussed in our previous videos what is universal precaution. Most of the doctors in different academies, they don't say universal precaution. This means that they don't verbalize that assume I have taken all universal precautions. This means that you are safe doctor, that you take all the safety measurements. For example, wearing gloves and apron and all the things that you have done. So the examiner will differentiate you from the other candidates. So you must say that assume I have taken all universal precautions to get maximum marks from other candidates. The third thing is acknowledgement. What is acknowledgement? Acknowledgement is that what actually you see, you should tell. For example, the patient is vomiting or he is in pain, you must say that, okay, Mr. Robert, I can see that you are vomiting. I'm here to help out you. This is acknowledgement. Okay, if he's have some difficulty in breathing, say, okay, Mr. Robert, I can see that you are having some difficulty in breathing. I'm here to help out you. This is acknowledgement. And most of the doctor do not do acknowledge, and they ignore the patient and they move on. So if you acknowledge, it will you will get more marks in terms of your IPS. So in reflect, what is reflect? So reflection is that if patient said that I have pain in tummy or whatever he said, you should reflect on that point rather than ignore and you move on. For example, patient said that I have pain in my tummy or I have pain in my chest. You must say that, okay, Robert, I'm sorry to hear about this pain, or I'm really sorry what actually you are going through. But let me ask you a question just to have better understand what actually causing this pain. This is reflection. Rather than ask bombarding of questions on pain, first reflect and then ask the questions for differential diagnosis. Understand? So introduction, these four things you should be keep in mind, and most of the doctors don't work on these points, and they make more mistakes, and all of these points are also important in different stations. For example, for example in your for example in other examination station also, and it will increase or boost your IPS. Understand? So second thing is delay in oxygen. Most of the doctor wait oxygen uh, provision in breathing part. This is totally wrong. You should give oxygen as soon as possible whenever you see that the oxygen situation is 93 or below the 93, until unless patient don't have any COPD or any obstructive condition. So if if you see oxygen saturation is 93, you should immediately give oxygen in a part of A to E assessment. Okay, so come to next. And the GMC guys really like oxygen and they love oxygen. So you should be a safe doctor and you should give oxygen as soon as possible. Okay. The third thing is they verbalize but don't carry out tasks. Most of the doctors make their reflexes on Simman and they do practice a lot, but just doing verbalize. For example, A2 assessment, you just verbalize, I'm going to do this, that, but you don't carry out the task alongside. So what I am suggest that you should practice while verbalize. For example, if you verbalize that I'm gonna give paracetamol infusion, so you should take paracetamol from crystally and then you should place it on side of arms of patient or hang over the stand. If you don't do this, you will not get marks. Okay, what actually you are well pricing, you should go and you should take, for example, if you're gonna check his BSR, you should go to Grace Trolley and then take glucometer and place it on the finger of the patient. Okay, if you just verbalize that I'm going to do blood sugar level, then it will not work. The fourth thing is chaperone. Chaperone is most important thing for doctor's safety as well as for the patient privacy. So, but actually, you should be clever at this point. You should be tell to the patient that I have a chaperone along with me to maintain your privacy. If you don't do this, you will get fail because chaperone is most important. Patient privacy is most important, and most of the doctor forget to tell chaperone whenever you have in contact with patient or clinical setting, in examination, in even in your procedures, you should tell that you have a chaperone. Okay, so don't forget chaperone. Panic while perform. Most of the doctors panic while perform during Simman station, especially if they don't get anything. For example, if they don't get IV cannulas or any infusion or glucometer, they start panicking and they mess up with the station. You should not be panic. You should be act like a very calmly confident doctor in A&E as you are working in your home country. A&E just like it's normal routine, and you should go gradually, keep relaxed, and then take. If you don't find the anything from the crystal, you should verbalize it. At the moment, I don't find the IV infusion. I'll ask my staff or nurse staff or my colleague to help me to bring this IV infusion, and you should start and move forward. Okay, don't be stuck at that point, and it will mess up with your station. So don't be panic. You should be calmly, and if you don't find anything, you should tell that at the moment I'm not finding this, and I will help. I will seek help from my colleague. So don't panic. Rush to complete. Most of the doctor like they just want to complete their station within 8 minutes. This is not possible ideally. This is just to demonstrate in 8 minutes how you keep calm yourself and how you do in pressure. So you will start from A to E assessment very calmly and step by step without skipping A. You should not jump into B. For example, if you have given into oxygen in A, you should give in A. You should not skip that point and then you should jump into the B. Similarly, if you didn't manage or the B part in breathing part, you should not jump into the C part, circulation part. So if even if you reach D part and you have done all the previous A to E assessment correctly, then you will pass with good marks. You don't want you to rush to complete this station. Even you can even complete your station by keep yourself calm and do step by step. Okay, so this is wrong way to complete. You even most of the doctors fail even they completed their A to E assessment because of the rushness. You skip a lot of things in between, so it will be harmful for you to get good marks. So, ladies and gentlemen, all these points you should keep in mind to get maximum marks in your plab 2 or your cumulative exams. Okay, and the one last thing is that whenever you uh, do examine on patient or asking patient, don't look at the examiner or anything else. Don't ask to the examiner. You should talk to the patient. You should act on the patient rather than to the examiner. For example, now, Mr. Robert, I'm going to give you IV infusion of fluids. Would that be okay? I'm going to give you some paracetamol infusion. Would that be okay? You should talk to the patient rather than to the examiner. So, thank you so much, guys, for listening, for watching. Please, if you didn't uh, subscribe my channel, please subscribe for good videos and useful videos, and please share it with your friends. If you have any queries, please do comment on comment box. Thank you so much.